Hello friend, welcome back to my channel. Today we'll be continuing our series on ventilator machine. The working principle of a ventilator machine involves the delivery of controlled amounts of breathable air, including oxygen if necessary, to a patient's lungs. The machine uses a combination of mechanical components, sensors, and controls to perform this task. Here's a breakdown of the working principle. 1. Oxygen supply. The ventilator is connected to a source of medical-grade oxygen, which can be a central oxygen system or oxygen cylinders. 1. This ensures a continuous supply of oxygen for the patient. 2. Air intake and filtration. The machine draws in ambient air from the surrounding environment. 2. The air may pass through filters to remove impurities and particles before entering the ventilator. 3. Breathing circuit. The air, mixed with the oxygen supply, is delivered to the patient's airway through a breathing circuit. 3. The breathing circuit consists of tubes and valves that allow the air to flow in and out of the patient's lungs. 4. Sensors. The ventilator incorporates various sensors to monitor the patient's respiratory parameters and provide feedback to the machine. 4. Common sensors include flow sensors, pressure sensors, and oxygen sensors. 4. These sensors help the ventilator measure variables such as airflow, pressure levels, and oxygen concentration. 5. Control panel and settings. Medical professionals program the ventilator using a control panel. 5. They set parameters such as tidal volume, the amount of air delivered with each breath, respiratory rate, inspiratory, expiratory ratio, and other ventilation modes. 5. These settings are tailored to the patient's condition and respiratory needs. 6. Ventilation modes. Ventilators offer different ventilation modes to adapt to the patient's requirements. 6. Some common modes include assist control, AC, synchronized intermittent mandatory ventilation, SIMV, and pressure support ventilation, PSV. 6. Each mode regulates the timing, volume, and pressure of the breaths delivered by the machine. 7. Alarms and safety features. Ventilators are equipped with alarms and safety mechanisms to ensure patient safety. 7. Alarms can detect issues such as high or low airway pressure, disconnection of the breathing circuit, low oxygen levels, or abnormal respiratory patterns. 7. Safety features help prevent excessive pressures that could harm the patient's lungs. 8. Monitoring and feedback. The ventilator continuously monitors the patient's vital signs, including oxygen saturation, heart rate, blood pressure, and carbon dioxide levels. 8. The machine uses the feedback from the sensors to make adjustments to the delivered air, oxygen concentration, and ventilation settings as needed. By maintaining controlled airflow, pressure, and oxygen levels, the ventilator supports the patient's breathing and ensures an adequate exchange of gases in the lungs. This helps to provide respiratory support to patients who are unable to breathe effectively on their own or need assistance during critical illness or surgery. While ventilator machines are crucial medical devices, errors can occur during their use. Some possible errors or complications associated with ventilator machine usage include: 1. Ventilator-associated lung injury, VALI. Improper settings or high pressures delivered by the ventilator can potentially cause lung damage, leading to VALI. 1. This can occur due to excessive tidal volume, high airway pressure, or prolonged mechanical ventilation. 2. Barotrauma. If the ventilator delivers excessive airway pressure, it can cause barotrauma, which includes conditions like pneumothorax, collapsed lung, or pneumomediastinum, air in the chest cavity. 2. These complications arise from the rupture of lung tissue due to increased pressure. 3. Ventilator-associated pneumonia, VAP. Infections can develop in patients who are on mechanical ventilation for an extended period. 3. VAP occurs when bacteria or other pathogens enter the lungs through the breathing tube or the ventilator circuit. 4. Ventilator-induced diaphragmatic dysfunction, VIDD. Prolonged use of mechanical ventilation can lead to diaphragmatic weakness and atrophy, resulting in difficulty weaning the patient off the ventilator. 5. Oxygen toxicity. If the delivered oxygen concentration is too high for an extended period, it can cause oxygen toxicity, leading to lung damage and other complications. 6. Ventilator malfunction or failure. Mechanical issues or technical failures of the ventilator itself can occur, resulting in inadequate ventilation, alarms not functioning correctly, or other malfunctions that may compromise patient care. 7. Ventilator-associated events, VAE. These include events such as pneumothorax, pulmonary embolism, or respiratory failure that occur while the patient is on mechanical ventilation. 7. These events can arise due to multiple factors, including ventilator-related factors. 8. Misinterpretation of data or settings. Human errors in interpreting patient data or incorrectly programming or adjusting the ventilator settings can result in inadequate or excessive ventilation. 9. Disconnection or displacement. Accidental disconnection of the breathing tube or improper placement of the tube within the patient's airway can disrupt ventilation and compromise patient safety. To minimize these errors, healthcare professionals receive specialized training in ventilator management, closely monitor patients, and follow established protocols for ventilator care. Regular equipment maintenance, adherence to infection control measures, and continuous education are essential for reducing errors and ensuring patient safety during mechanical ventilation. There are several brands and manufacturers of ventilators used worldwide. Some well-known brands in the field of ventilator manufacturing include 1. Medtronic. 2. Philips Healthcare. 3. Dragerwork AG & Company. KGaA. 4. GE Healthcare. 5. Hamilton Medical. 6. ResMed. 7. McKay, a subsidiary of Getinge. 8. Smiths Medical. 9. Fisher & Paykel Healthcare. 10. Bayer Medical. These brands have a long history of producing reliable and high-quality ventilators, and their products are commonly used in hospitals, critical care units, and other healthcare settings globally. It's worth noting that there are also smaller or regional manufacturers that contribute to the ventilator market, particularly during times of increased demand or in specific regions. It's important to consult with healthcare professionals and medical equipment experts to determine the appropriate ventilator brand and model for specific patient needs and healthcare facilities. Hello everyone. I'm excited to announce that we have a fantastic video coming up next week. We'll be continuing our series on medical devices. So mark your calendars and stay tuned for our upcoming video release next week. You won't want to miss it. Thank you.